Welcome to the Thursday, October 6th, 2022 Health Committee meeting. And we have 6 members present, so we do have a quorum. We have minutes to approve from September 1st, 2022 regular meeting. Do I have a motion? Motion by Beer, second by Chung. All in favor, or any additions or corrections? All in favor? Any opposed? Okay, the minutes are approved. We have one member of the public that is asked to speak, and that is Marita Landreth. So if you want to come up to the table there and.
Welcome, Marita. If you push the button on the bottom right corner, it will come on as a red light, and that means that you're on and we can hear you.
I have a master's degree, I swear I know, left from right. Esteemed members of the committee, my name is Marita Landreth. I am a nurse and I'm a McLean County resident. Some of you may know that I work for the McLean County FUSE program, which is a wraparound case management program for people with serious mental illness. And while that's true, I am here today as a private citizen. However, my experience, my last 2 years in the McLean County FUSE program, have revealed a gap in public health services available in the county that I need your help with. The services that I'm talking about are what is referred to as harm reduction services. They include services to prevent and respond to opioid overdose and are encompassed with also including safe syringe exchange, sharps disposal, provision of naloxone, and provision of training on substances for fentanyl, which has been an increasing issue in the national, state, and local street drug supply. Luckily, our community already offers some access to Narcan through several private agencies and basically any pharmacy that you can go to, but we are missing several other pieces of this harm reduction puzzle. The closest comprehensive harm reduction service site currently is JOLT, J-O-L-T, in Peoria. I, along with other residents interested in these services, have spoken to their leadership about their program, and we're absolutely floored by their outcomes. After 1 year of services through JOLT, Peoria has seen their opioid overdoses cut in half. They also calculated that in providing services just to 2 residents over 9 months, that they saved $250,000 in potential medical and public service costs. Decreasing overdose numbers is a worthy goal, but I also come to encourage the committee to consider the philosophical implications of harm reduction as a service. Harm reduction affirms that every person who uses drugs deserves to live, deserves care with dignity, and deserves agency over their lives. It does not ignore that drug use can be dangerous. In fact, many people who use drugs that are not yet ready to engage in a recovery journey will start a relationship with the harm reduction service because they are aware of the risks and they want to live as healthily as possible. Many people with substance use disorders who engage in harm reduction services eventually pursue treatment, but they can't recover if they're dead. If the idea of handing someone who uses drugs a new syringe to use drugs with sounds strange to you, because it sounds strange to many people, consider the other ways that we already provide methods of harm reduction to people who engage in risky activities. Seatbelts, licenses, training for people who drive, motorcycle helmets for people who ride bicycles, motorcycles, condoms, STD testing, education for people who engage in sex. These are already things that we do. My recommendations to the committee are the following. Seek out more information about harm reduction services. You can go to the Harm Reduction International site or the National Harm Reduction Coalition. And I would very seriously have you consider contacting JOLT directly because they've already told us that they have presentations available. They're available to do lunch and learns. I'm sure they'd be able to come to a meeting if you wanted them to. My other recommendation would be to establish or possibly reestablish, I'm still unclear if it actually existed before, a syringe service program through the health department and to work with cities and towns in McLean County to install publicly accessible sharps containers so that needles and syringes can be safely disposed of, which would also provide a service to anyone else that uses syringes for medication administration. I also recommend, if you have not already, to seek training on how to administer Narcan and to support initiatives meant to make Narcan more accessible in our community. Support the dissemination of interventions such as fentanyl test strips for testing substances for fentanyl. And keep in mind that we cannot dictate the lives of anyone, let alone people who use drugs, but we can help both treat and prevent overdoses, prevent skin infections, bloodborne diseases. We can prevent suffering. Please do not for 1 minute think that ignoring, or worse, promoting suffering of drug users will keep people from using drugs or keep people from overdosing. Not only does substance use disorder not work like that, but this thinking does not align with the mission of the health department, and I would wager it doesn't align with the personal missions of the members of this committee here today. There are people in this community who are invested in bringing these services here, and I believe that it is coming. This is your first invitation to be a part of an incredible public good. Thank you.
Thank you. Moving on to departmental matters. We have, does anybody have any questions for Mr. Tab on his report? And if you
Sorry.
do, then I'll bring him up.
Is he do the thing with the jail medical too? Or-
No.
Okay. I'm still unclear on that, so thanks.
Mr. Tab is over our juvenile detention center? Nope. We do have a representation from our McLean County Detention Facility for the adult side.
So if no one has any questions for Mr. Tab, and if Mr. Tab has nothing to say about his report, then we'll just keep moving on. Next is Diane Hughes, Jail Superintendent for Jail Medical, and you do have a question, Ms. Chung? I do. Okay, if that's all right. Ms. Hughes, if you'd like to come up, please. And Taylor, whose last name I cannot remember.
I'm Diane Hughes, the jail superintendent, and this is Taylor Martins. She is, works for ACH and contracted as our health services administrator.
Member Chung.
Yes, thank you. Thank you so much for this report. I feel like I'm seeing things in here that I didn't see in the past reports that we've had from jail medical. So it kind of paints a, I don't know, just a different picture or an interesting picture, just something else I just haven't thought of. I'm just curious about a couple of things here. When you see, I'm just assuming, and this is just what I want to clarify, is that when we see something that says like 137 counseling visits, is that's not 137 like different people? Like say like it's just different visits, so like some of those visits could have gone to the same person? Do you know what I'm trying to say? Sorry, I'm not very coherent today.
Are they,
But say like,
are they
say-
duplicated?
Yes, thank you.
Total number of people seen. Yes, it is total number seen.
Total
So it
number.
could be the same person more than once.
Okay, great. Thank you. That's just a clarification I wanted to know. And this part in the, sorry, this part in the report where it says medical grievances total number, and it says that there's this different like little comments here. Is there, I guess I was just wondering if it would be violating any sort of laws if we like have more of a breakdown on that? Would that be possible to give us that? Like more like of a breakdown of how many, I mean, are these all the grievances? Are there more grievances? I guess I'm just trying to understand
That
this
is the
more.
number of grievances that they had for this.
Okay, so
For
that's.
medical.
So some of
Yes.
them could be, so say, for instance, like
These are
so
medical, yes.
the waiting time for sick calls, so that somebody could have done like 3 grievances for that okay,
Yes,
gotcha,
yes.
thank you. Then that makes sense to me. Thank you, I appreciate it. And so like I was saying that I'm interested in this report because I'm seeing some information in here that we haven't really seen before, and I appreciate it. So thank you so much.
I'd like to add that in January, this is all a process, work in progress. Some of the stuff will be different. We're looking to have more kind of spreadsheets and stuff. with more information. But I think January 1st would be the starting point for that to make sure all our numbers are starting fresh.
Thank you. Yes, I do appreciate this report because it does give me more information than it gave in the past. So I do appreciate that. What does DNT mean?
We did not track that.
You didn't track that? Okay.
Correct.
And will you be tracking that, or is it just, is that part of the work in progress part?
So currently, I've been working with Jackie, and she's over the mental health department. And I showed her what we need to be tracking and asked if we could possibly track that. And they are currently working on providing those numbers.
Good. Okay, thank you. Anyone else have a question? Member Pell?
No, go ahead. I have a comment, so I'll.
Okay. There's 3 shifts, am I correct, at the jail? Correct. Okay. And at any given shift, there should be a log of activities that have happened, and then the people that track the record keeping of that, they're the ones that are compiling this information. Is that correct?
So I came in about September 1st. So I went ahead and pulled all this data. What I currently have put into kind of like our daily work is I have a daily tracker log where it asks exactly how many people did we see, what did we see them for, was this an incident, was that an incident, so I can get more detailed information to see where we can improve.
So when there's an incident report filed, it is filed as the correction officers made contact with that individual. This was the problem. And at the end of that report should be what that person did to correct the problem or help that person out. And then that's given to the next shift in a briefing. Is that all typed up, or is it all on a computer system?
I'm a little confused on the question because there's incident reports generated for various reasons, but we're talking medically, right? So any medical reports, the shift supervisor, if there's an incident related to medical or somebody needs medical follow-up, we actually have an email that they will send, and it will go to all the jail nurses, it goes to the administration sergeants, other sergeants that say, Bob Smith needs this follow-up. We had this incident on the shift that I was working. So yeah, they communicate that electronically as well.
Thank you.
Ms. Taylor?
My comment was just to echo what Superintendent Hughes had mentioned, that this is a work in progress and you should see some future iterations of this report, because to remind you all, we just recently contracted to have an EMR, an electronic medical record system, in our adult facility. And so before, these were hashtag counted figures. And so we really would like to come into this century and have reports that are easier for Taylor and her team to record, but also then to use that data for purposes of reporting and also process improvement.
Any other questions? Okay, thank you. Next up is Tim Wiley, Nursing Home Administrator. And you have 2 items for action. The first is request approval of Nursing Home 2023 private pay rate. I have a motion. Motion by Martin, second by Metzger. Anything you want to say about that? You have a memo regarding that?
No, this is a fairly typical private pay rate increase.
Does anyone have any questions? Hearing none, all in favor? Any opposed? Motion has been approved. And the second item is request approval of a grant agreement between the State of Illinois, Department of Healthcare and Family Services, and the County of McLean on pages 8 through 47 of the packet. And do I have a motion? Motion by Beer, second by Chung. And do you want to talk about that?
This is the most recent grant opportunity that's been afforded to the home, 65% of which has to be used as a pass-through to the employees that meet a certain economic criteria, and then 35% can be used for anything related to infection control, medical supplies. And actually, it's good through June 30 of 2023 for utilization.
Anyone have any questions? Okay, hearing none. All in favor? Any opposed? And that is approved. You have your monthly report. Is there any thing you want to point out, or do we have any questions?
There's one thing that I'm excited to share with the committee, and actually it's outside this reporting period, but I couldn't keep it in, and that is the month of September. Bear in mind, we've averaged around 50% of our nursing shifts covered through agency utilization. For the month of September, we were at 22%.
Awesome, awesome. Good work. That's, keep the goal going down, so. Anyone else? Member Metzger.
At Finance last night, we received some results, and it actually had September was part of that, I believe, if I'm not mistaken. And you had a very good month there, too, on the revenues were quite good. And so those expenses were not as in the negative as what we've seen in the past. So I'd just like to compliment you and your staff for working on that and making sure that attention is placed in that area. So appreciate the efforts. Thank you.
Thank you for that encouragement.
Hearing nothing else, thank you. We'll see you later. Does anyone have any questions about Ms. McKnight's report? Okay, hearing none on that. We'll move on to the county administrator.
Thank you, Chair Schaefer. I have several items to present for action this evening, as this is our budget cycle and your opportunity to ask questions about the budget and approve those different departments that fall under the purview of the Health Committee. The first is E1A, request approval of Tort Judgment Fund 0135, Department 0077, fiscal year 2023 recommended budget for the Juvenile Detention Program 0022 and the Risk Management Jail Correctional Health Services Program 0073. That's found on pages 63 through 69.
Motion by Beer, second by Bell. Any questions?
Why don't we go ahead with this? Because that might answer any questions
Okay,
that I
I'm
have.
sorry, I forgot about this part.
Thank you. The JDC medical budget provides access to mental health services, one staff RN that is full-time to meet the needs of our youth that are in the center. The salary is 56% of the budget, supplies are 7%, and services are 37%. We do have a data error to correct on page, is it on page 63? And that is for 0612.0001, the books, videos, publication line. That has an extra 3 at the end of it. That should actually be $400. Sorry for that. We had happy fingers when we were calculating. So this pie chart shows the overall expenses for this division, and it is a 1% increase over last year's budget. So basically a maintenance budget.
Okay, Now, are there any questions?
And I'll move on to the jail medical. So for the jail medical budget, the total expenses are 1.6 million. Salaries are 2.8% of expenses, services 85%, and supplies are 12%. You might wonder about the salaries being so low, and that is because in July of 2022, we switched to a contract with ACH for the majority of those health services. All of the contracted medical director and nursing staff are out of ACH. And so we only maintain one FTE in this department now, and that is an administrative services position.
Any questions on this one? You're frowning.
These people have contracts, am I correct, that you contract a service, so how long is that contract? Is it renewable every year, or is it's like being on pins and needles waiting whether you're going to have a job or not?
No, the contract is with the agency, the Advanced Correctional Healthcare Agency, and it is renewable every year, but it is an ongoing contract.
Any other questions? Hearing none, all in favor? Aye. Any opposed? Okay. Thank you.
Thank you. Next up, we have E1B, request approval of the Health Department's 0061 fiscal year 2023 recommended budget, and that includes 7 different funds that if, with the permission of the committee, I'd like to take as one action item, 1 through 7. So that would be pages 70 through pages 94, and I do have a PowerPoint to explain that a little
Does anybody have
deeper.
any objection to that? Okay, thank you. So we need a motion. Motion by Jung, second by Beer. Sorry.
Thank you. So we received this information from Health Department staff. This is a breakdown of the tax levy for the Health Department. It breaks it down per tax rate, per all of the different allocations for programs. The tax levy rate, if you look at that bottom right-hand corner, the 2022 rate and the 2023 rate all the way at the bottom, you'll see that it's 0.11083 for both years. It was kept level from last year. For revenues, our total budget revenues equal 9.1 million. Again, the tax rate was kept level, and that is a breakdown of the source of revenues. So 54% from property tax, 34% from intergovernmental services. We have license fees and permits, and the rest that are smaller amounts. When you see that fund balance of 5%, that's across all funds. That includes the grant funds, so it's not a reflection of the fund balance for just the levy funds. For Health Department expenses, on the left-hand side, that pie chart shows the total department as a whole. And then you can also see the difference with broken down by grants only or by tax dollars only. In all 3 examples, salaries make up a huge component.
And I'd like to clarify that this is for the Dental Sealant Grant 102, Personal Health Services Programs 0062, the WIC Grant Fund 103, Personal Health Services Program 0062, Preventative Health Grant Program 105, Health Promotions Program 0067, Family Case Management Grant Fund 106, Personal Health Services Program 0062, AIDS Communicable Disease Control Grant Fund 107, Environmental Health Program 0061, and Personal Health Services Program 0062, and Federal Financial Program Grant Fund 109, Personal Health Services Program 0062, and Persons with Developmental Disabilities Grant Fund 110, Mental Health Program 0060. Actually, we probably shouldn't include that one. That's kind of separate, that's a separate levy.
Well, it's in with the Developmental Disabilities Fund, the 110 fund. So the 112 funds are the separate.
Well, it's still a separate levy, though, separate part of the levy. Okay, we can put it together, okay. Pardon? Mental Health Program 0060 is not in this right now? No. Okay, just making sure. No. So I just wanted to clarify that those were the funds that we were discussing here as a whole group. So, does anyone have any questions? And just, Ms. McKnight, if you'd like to, you can move the table, or the chair back.
I just couldn't see it, so please.
Actually, that corner table there, right beside Ms. Bell, might be the best.
I have a number of questions, not, and so I have to kind of go through them. So I'm looking at the WIC program, 0103, unappropriated fund balance, significant increase. What is that grant? What's causing a fund balance increase to that degree?
So the change was due to the salary study, is the fund balance that's included in here.
See,
From
oh, it's revenue from the
Revenue
okay.
from the fund balance.
Got it.
That as
Okay.
revenue.
Okay.
And
And so you're bringing it in
that's
from
in
the
several
fund
other
balance.
places in
Okay.
this. So
All right.
none of these funds utilize any property tax dollars. These are pretty much grant funded.
Also, under 0106, case management, can you tell me what the assurance network is? That has increased significantly also. I'm on page 81, and it's,
okay, so the AOK contract, that was remember we previously approved an additional FTE, so an additional family engagement specialist. So the grant itself this year for 2023 was increased, and that is to include that FTE. So that's
Okay.
what we got from the state.
got it, okay. You did also have on your 0107 AIDS and communicable disease control, the non-major equipment. Last year, apparently you didn't spend as much as you anticipated. Is that what happened on that one? It would be 0621 0001, non-major equipment. So you, on 86, yes, thank you.
Yeah, so this is where the COVID money did fall. So
Okay.
it could possibly just be that it was based on an expense.
You
what we
didn't have to
planned
use
for
it
last-
because you, okay,
Yeah.
all right, very good. And it seems that in that same, on page 87, you've got quite a few, your postage is up, advertising, contractual services. Is there something increasing? Is there a requirement? Or is it just something that you're planning on legal notices, advertising, and postage? Contractual services are all, and then also RUM. Those are all significantly higher than they've been in the past, percentage-wise, so I was just curious.
So I'm looking at advertising, and you said postage as well.
postage is increased by 100%,
Yeah, so it went from
but
100.
it's not significant.
Yeah,
I'm just,
100 to 200, so.
yeah, but mostly the others, contract services is up, and so is advertising and legal notices.
Yeah, off the top of my head, I
Okay.
don't know.
I was just trying to figure out if there was something that was being required of your department that, or if there's a new philosophy.
Nope, and this one is definitely difficult to compare to the last 2 years because it is where so much COVID money has gone.
Okay.
And there is a new grant in here as well. So, yeah, it's kind of hard
And
to
we don't
compare.
have to beat up on this because I know it's grant money, but, and I know the auditor is on that really strongly, so I know you're utilizing those as well as you can. So those are all my questions. Thank you.
Does anyone else have any other questions about
Yes,
these?
last time, I think it's last time you were here, you were going to use some COVID money to hire new people. Am I correct? Was that one of the things you asked for when you were here last time or the time before? To hire new staff?
We did recently increase our FTEs to add disease intervention specialists, and they are working on communicable diseases such as COVID. So they initially were brought on with COVID money, and they'll be sustained with a new grant through IDPH that's specifically for disease intervention specialists. So those are the only new FTEs that we're bringing on right now.
Last question is, for the monkey virus, do they need special training, and how many people are specially trained in administrating the monkey virus correctly?
So are you speaking of the vaccine, the Jynneos?
Yes, the vaccine, excuse me.
So they do need special training for intradermal administration, but luckily our nurses are all trained in that. So we are currently giving the vaccine, and all of our nurses are trained to do that.
Any other questions? Okay, hearing none. All in favor? Any opposed? Okay, all of those passed.
Okay, moving on. Okay, moving on. The next up is our E1B8 Health Department Fund 112. 7 was included in the last. So there's a mental health program 0060 that's included in Fund 112. So that, I'm going to read those off. So number 8, Health Department Fund 112, 8.1, Mental Health Program 0060, 8.2, Environmental Health Program 0061, 8.3, Personal Health Services Program 0062, 8.4, Administrative Support Program 0063, 8.5, Immunization Program 0064, 8.6, Health Promotion Program 0067, 8.7, Problem Solving Courts Program 0069, 8.8, Community Outreach Program 0096, and 8.9, TB Care and Treatment Program 0111.
Thank you. Did you want to? Oh, need a motion? Motion by Chung, second by Beer. Do you want to go ahead?
One thing I'd like to say is we're bringing forward the budget today that was approved by the Board of Health at our meeting in September. And the budget includes an amendment to add an additional $300,000 of the Fund 112 fund balance to mental health services. So that is not reflected here, but that was an amendment that the Board of Health made whenever they approved the budget to come forward.
Thank you. Any questions? Member Metzger.
I'm certainly in favor of whatever we can do with our mental health. I am curious as to, are you able to leverage any of the tax monies that are being generated through the town of Normal and the city of Bloomington for your budget?
No, separate levy.
Okay, so it's all levy money.
So, yeah, this is ours separate from the town of Normal and the city.
Okay, so you are then bringing a fund balance, you're using some of the $4 million that you have,
Yes,
but so that's 300,000 for just the mental health piece.
yes, and that would bring the total of 112 fund balance used it to 208,000. I believe it's $22.
I'm sorry?
So, sorry, that was the original. $208,022 was the original, so this would bring that up to $508,000.
However, when we had our Board of Health meeting, I was not supportive of that because one of the things that there's still some uncertainties on some funding that we already have property tax dollars allocated for that we have not, there has not been a decision made on how that's going to be funded and what's going to be funded. And so there is no defined use for that additional money that was done at the Board of Health meeting. And then that really doesn't solve some of the problem of fund balance. Because then if it does not get spent, it's then back into fund balance again. So it doesn't really,
So there is money coming in from other sources that we're aware of, or we don't know how much it is?
we don't know anything. There's a couple of areas that we have not, the Policy and Funding Committee for the mental health side, money, property tax dollars, has not made final decisions on what is going to be funded and how much it's going to be funded. And so there may be more or less desire in that area. Right now, it's unknown. And that's why I was not supportive of just putting more money towards it until we know, we have better understanding of as to what
And when will that take place?
the next Policy and Funding meeting is November 4th, which is the day after this meeting.
So what do you suggest? Can we, at some other point, pull money from the fund balance to fund this, should it's needed? If
Oh,
things don't,
absolutely,
then
absolutely.
why don't we do that?
Yeah, that would be my suggestion, is to not utilize that 300,000 in that respect, because then if there is something that is decided, another program or something that they want to start, then we could do a budget amendment, and I've explained that to the Board of Health in the past too, that if we want to do something like that and then take money out of the fund balance to do that, that's, like I said, because a lot of times money doesn't get, I mean, and one of the reasons even the 112 right now is got more fund balance and hasn't really gone down is because there have been vacant positions, so then that just goes into their fund balance, and it
No,
doesn't-
and didn't you, I think I saw a fund balance from last year to be, hang on, I thought I had a fund balance, was it 900,000?
That was
added to
over,
the
that's
fund
over a
balance?
period of 7 years. It
So
has
we've added
increased, the fund
two-
balance has increased $901,000.
$900,000. I'm having a hard time, and it's not just with the mental health. It's with this entire 112. We should never be stockpiling money, taxpayer money, to that degree. That's unacceptable, in my opinion. I believe that we need, and where it goes, I think Member Schaefer is actually our expert. I do believe that if she thinks we should wait on this 300,000 there, but I do believe that we can reduce that levy significantly for 0112 and decrease that levy, I would say by $700,000 and take that amount of money out of that fund balance. We should not be carrying $4 million in fund balances. It's not acceptable. We had the same conversation yesterday for a $2.7 million fund balance for the extension. They didn't listen to us for 4 years, and the only way we're able to get them to listen to us that we need to reduce that, they have more than enough money to keep going, and you have more than enough money to keep going. I know it was set aside at one point for a pandemic. We had a pandemic, and we were able to survive it. And I don't think taking $700,000 out of that is going to cause any major concerns. And I think we need to lower this tax levy because it's been too high for many, many years. And if we have over 7 years brought $900,000 into that, that's taxpayer money. So my recommendation, and I don't know when we make that recommendation, if we make it now or we go through this whole thing, is to reduce that tax rate down enough that we can utilize about $700,000 of reserve. So do I make that in a motion?
Motion?
So basically, we're going to table this until November 4th and see what happens.
We can't.
Well, okay, so here's a timing issue. But I want to back up for a minute, okay? Just for those of you that are newer on the board, is that this has been an issue for many years. It has been discussed at the Board of Health for many years, and hasn't really come to this point yet. But for many years, it's been discussed at the Board of Health on reducing the fund balance. And it's never happened. And we kept saying it over and over. Member Chung's been on the board for 4 years. You've been on the board for 4 years too. But 2 years? Okay. But it really hasn't come before this committee. But it has been discussed numerous over, even before Member Chung was on the board, with the Board of Health. So it's kind of at that time where people are looking at this kind of thing, just like they're looking at the extension service. And so, so there's some historical. It's not Ms. McKnight at all.
No, it's no
It's-
reflection
This
on
is
her.
not anything against Ms. McKnight, because this happened much longer before she ever came to the department. So it's not, it's not, I just want to make that clear. And that's why I wanted to give that little historical background there, to make sure that you all understand that part of
It was way before her. Obviously, 7 years of tax levies to the tune of $900,000, and previously, now we have 4 million? Is that about what we've got?
Yeah, it's,
We were actually just looking at those figures to share with you some detailed information. I would like Ms. Dreyer to share that with you at this time.
So right now, the fund balance is at 4.2 million, but that's because we've collected all of the property tax money. And so they still have a whole quarter of expenses that a portion of that money will be used on. So if you look at it at the beginning of the year, it was 2.6 million. So you have to consider the expenses that are going to come out of that fund balance between now and the end of the year.
And what would you anticipate that being then? I still don't think $700,000 is going to break them. I mean, I think $700,000 is still a pretty good amount of money. It would lower that tax rate, and they still would have enough money if you had what did you say,
2.6.
2.6, let's just say $600,000, they still have I mean, I just still think we need to start ratcheting this down. This is not good to have that kind of money sitting. It's taxpayer money, and we have a responsibility to our taxpayers. And so what we're going to do is ask for more? I can't do that. So
Did you make a motion?
yeah, we can. So I move we reduce the levy $700,000, and that money come from the reserve. So I can't tell you what that tax rate would be because I don't have my calculator, but
And this is specifically for 0112-60 mental health? That
no.
one?
Oh, no. The whole thing.
I see.
Yes, take the whole thing. You can leave mental health, just give, mental health, don't touch it if that's what we want to do.
That lowers the 112 tax rate to 0.07478.
Okay. That's,
Could you repeat that, Ms. Dryer, please?
0.07478.
And
We
what
have
about,
a motion, do we have a second?
all right, it fails.
Okay, there's not a second on that motion, so,
So I just have to ask this committee, how much money do we want? I mean, what's the point in, why would we not want to reduce the levy?
Can I ask you a question, Chair Schaefer? You said that you've been discussing this at the Board of Health about this too then? And I guess because they're the ones who, I mean, yes, we approve the budget, but they're the ones who oversee what the health department does. So I'm just wondering what the consensus is there.
there was discussion, because I brought this up again, and said, we need to spend some of this reserve or reduce the levy. And, I mean, I didn't have a number other than 500,000 to 700,000 reducing the levy, because I think that, if what Ms. Dryer said, 2.6 million to get you through that first, until our property taxes come in. So how are you going to reduce so I heard from various people on the board, $500,000 to $700,000 reduction. And so it was, Ms. McKnight had 200,000 in the budget that was presented to the Board of Health. 200,000 from utilizing reserves, 200,000 in the 112. And so then there was a motion that was made to take 300,000 and add it to mental health. And that was where it was left, and I voted no, and everybody else voted yes. So that's kind of where we're at. Is that pretty accurate as to what happened? So, but like I said, this has been an issue for years. I support reducing the levy. I'm not sure we want to maybe go 700, maybe 500. Because if you do that over a period of, 4 or 5 years, it will get down to the number where we're talking about 2.6 million to get them through the first 6 months of the year before the tax dollars come in. So if we do that for, looking forward, and we also know that the EAV will go up next year probably again, and so that just doesn't help matters any sometimes, because it's great that we have more tax dollars coming into the county, but when you're trying to utilize things that we're going to be having the same conversation again next year, and the next year, and the next year. So, but I could support to 500,000 levy reduction. Member Bell?
Thank you, Ms. Schaefer. Our taxes went up on an average, property taxes 6%. Is that what I heard on the radio today? Basically, both mayors saying that there was a significant increase because of the property values and we don't have enough housing. Can this money be earmarked to help another entity like the extension program, and then be able to get matching funds from state and federal, so we can kind of keep a flow of things, so we don't have to table anything for the next month? I'm new at this, so I'm just asking.
What's that? What was yours? Yeah. These tax levies have to be used for public health. Excuse me.
So where do you want to go?
I just did some quick calculations, $700,000 reduction, which didn't pass, I understand, would still be a $4.2 million levy. 4.2 million instead of almost 5 million. So if you go 500,000, it would be 4.4, right? Isn't that what we're looking at?
Did you-
49?
Don't include
110. So it would be a $3.3 million levy.
3.3?
Oh, no, wait, 3.4. 3.4, my cursor moved.
My apologies.
So to answer Ms. Bell's question,
So the tax levy dollars that were dedicated to 112 cannot be used for 4-H extension. That's a separate tax levy. We cannot allocate those in that way.
Is there any way we can pull money out for something else that may be a little bit overinflated? I hate to use that word overinflated, but some things may be used, may not be used enough. I'm just trying to squeeze a little money out for, you say it's health, but extension program is a form of gardening, helping people come together. So it is a mental health issue, as far as I'm concerned, to have these programs out there for people. It's not necessarily a physical type thing, but it is also falls under mental, people trying to get back to normal after a pandemic.
I understand your logic. Unfortunately, the extension levy is only to be used by the U of I Extension Service and those programs, and these tax levy funds are under the operation of the Health Department. So I guess I'm a little confused at what you mean by trying to find a few dollars. I guess the dollars are there, they're available in the fund balance. So finding the money for the services is not necessarily the issue for the programming. The suggestion, I believe, by Member Metzger was not to cut programming by $700,000. It was to change the manner in which we supported those programs, the funding source. So instead of taxing the public for those programs that would be served by that $700,000, we would pull that out of our reserves or our fund balance, thinking of it kind of as our savings account.
Member Chung.
Thank you. I guess I just, I understand where Member Metzger's coming from. And I understand that, this has been an issue for a little while, but at the same time, I do feel a little blindsided because I wasn't expecting this today. So I'm just wondering if there's a way that we can actually look over, maybe discuss at some other point, so that maybe we can table this section of the budget for next month, if that's possible, so we can talk some more about it. And, I kind of, maybe if Ms. Dreyer can also give us some more, like, numbers instead. I'm very visual, so when you say numbers, like, it doesn't always register in my head that way. So if it's, maybe if we can get numbers sent over to take a look at it, we can kind of maybe talk about it some more amongst each other. That would be, my preference right now, but I don't know how else anybody else feels, but I could make a motion to table.
You could make a motion.
Yes.
You are
Yes,
making
I
a
am.
motion.
Yes, I am making a motion.
Okay.
I'm making a motion. I'm sorry.
Making a motion to table this to a date certain, which is our
Which is
next
next
meeting.
month. Yep.
To get more information and then make a decision and ask Ms. McKnight and Ms. Dreyer, Ms. Taylor, and any one of us that we want to talk amongst each other as to what direction we want to go with this. Because I think it's an issue, and I strongly, like I said, believe that we need to address this issue, just like we have addressed the issue with the extension service, and come to some kind of compromise that we all can be somewhat unhappy with. Member Metzger.
Is it, are we under a timeline? Is that we could table this and we are still okay? All right.
Okay,
made the
so
motion.
there's
Do you have a
a motion to table the 112. Until next month. Is, all in favor?
So it was motioned by Chung and second by Beer, is
By
that
Beer,
correct?
yeah. All in favor?
Aye.
Any opposed? Okay, thank you, and good luck. Sorry we took so long. Ms. McKnight is on her way to the Athena Award that she was nominated for, so
Oh, hey.
I was hoping it didn't quite take so long on that, but. Okay, next.
Okay, moving right along, next up
Nursing home.
is
Nursing home.
E1C, request approval of Nursing Home Fund 401, Nursing Home Department's 90 fiscal year 2023 recommended budget, including 1, Nursing Service Program 0080, 2, Social Services Program 0081, 3, Activities Program 0082, 4, Dietary Program 0083, Laundry Program 0084, 6, Domestic Services Program 0085, 7, Plant Operations and Maintenance Program 0086, and 8, General Administration Program 0087.
And can I have a motion for that, please? Motion by Beer, second by Bell. Questions? Oops, sorry. Presentation first.
And I would ask Mr. Wiley to come up to the table if you would, please. For revenues in 2023, the total budget is $9.931 million. Revenues by source include 17% for intergovernmental, 75% for charges for services, and 8% for transfers. And you have your pie chart there. And for The expense side, it is a balanced budget, so you have the same total on the expense side, and you can see there that salaries make up the majority of that pie chart, a little over 50%. And I had updated the slide to reflect the percentages, but for some reason that didn't save. So you have your visual there. And Mr. Wiley, myself, and Kathy Dreyer are happy to answer any questions you might have.
As you're looking over potential questions, let me say my budget section, for whatever reason, did not print with my packet, but I should be okay to answer questions.
My only question that I would have, and there is nothing from a line item perspective that I really have any concerns about. They appear relatively flat. I think mandatory fees went up significantly, and I think, is that the tax that we have to do now?
I appreciate you bringing that up. It not only is from the bed tax increase, but there were a couple of expense items that I recommended to administration that seemed to fit better in other GL categories, just by virtue of the name. And so that was one of them that I recommended we move. It fit more under mandatory fees. I want to think it had prior been under contractual services, and I didn't understand the logic, and so that accounted for the increase to that line item.
Okay. So basically, the change in the nursing home fees have increased, but the taxes have increased, and our taxpayers are having to pay that tax. Is that, I mean, if it's coming out of the levy, our taxpayers have to pay it. Is that what we're seeing?
No, this is
Oh, this
taxes
is-
paid by the facility. So
So,
what you were saying is actually accurate in that the daily reimbursement rate from HFS did increase, and they said, since you now have higher revenue, we will increase our provider tax for the facility as well. It resulted in a net gain for the facility, but not nearly what it should have been.
okay, okay. Very good, thank you.
Just a reminder, there's no property taxes that are
For
utilized
this
in the
particular
nursing
one.
home.
Yeah, I'd forgotten. I'm so sorry about that. The only other thing I am just curious about, as we increase the census, then we would probably see that increase. Then the other slide said 75%. We really want to see that percentage, the charges for services, to go up, I'm assuming? Is that, I mean, charges for services, the percentage, total percentage, if we continue to get the census up, we will see that percentage go up also?
Are you referring to the commensurate expenses?
So I think you won't necessarily see the percentage increase, but you will see the dollar amount
Dollar amount,
increase.
okay.
Because some of those transfers are related to other levies for IMRF and
Oh,
FICA that are taken out of another.
and that's going to be increasing because of our salary stuff, which is a positive, right?
Right.
Okay, very good, thank you.
Any other questions? Great. In that case, all in favor? Aye. Any opposed? Thank you. That was easy.
Thank you very
everyone.
much. Thank you, Mr. Wiley, and thank you to the committee. I have no other items to present this evening.
Okay, under other business and communication, I just want to point out that for those of you, which is all of us except Member Metzger, I believe, that are not on finance, if you did not have the opportunity to watch finance yesterday, to please watch that video. It was very instructive on the this, yeah, the compensation study. It was an excellent presentation. It answered a lot of the questions that I had. So I didn't have to ask them at these meetings. And so I thought it was very beneficial, and I think that all of us should make sure that we watch that, so we have a better understanding as to how it was done and what is going to be happening with salaries. So I thought that was very good. And so our next meeting is obviously November 3rd at our regularly scheduled time at 5:30. Does anybody else have any other business or communication? If not, we have bills to pay. Are we going that direction? Okay. Okay. The auditor has reviewed all the bills, and they comply with our ordinances, resolutions, and policies. So first, we have Board of Health has a prepaid total of $304,528.51. Motion by Martin, second by Metzger. Any questions? All in favor? Any opposed? Okay, Board of Health paid. You did that right. Nursing home has a prepaid total of $553,057.58. Motion by Metzger, second by Chung. Any questions on that? All in favor? Any opposed? Okay, nursing homes paid. The Developmental Disabilities Board has a prepaid total of $58,865.92. Motion by Chung, second by Beer. Any questions? All in favor? Any opposed? That one's paid. And finally, Jail Medical and JDC Medical have a prepaid total of $164,177.46. Motion by Beer, second by Bell. Any questions? All right, all in favor? Any opposed? And with that, we are adjourned.